Hello, my name is Kat Insminger. I'm joined by Jessica Glisson and Jason Lust, and our project is on spiritual and cultural diversity in nursing, and I'm going to be speaking about cultural diversity. As nurses, it's very important for us to provide culturally sensitive care, and we can do that by assessing our own beliefs and our own opinions of the cultures around us. I'm first going to be speaking about the Hispanic culture. There is a huge Hispanic and Latino population in the United States and specifically in the state of Florida. And below, you're going to see a lot of the most common illnesses that you're going to see in these Hispanic patients. And they include diabetes, hypertension, kidney disease, and liver disease. There's also what are called hot and cold illnesses. And basically, in Latino medicine, this is essentially the concept of the imbalance between the hot and cold humors of the body. Hispanic patients may also use herbal therapy and also may seek advice from traditional healing practices. And it's okay to implement these kinds of holistic practices into their plan of care. When it comes to mental health in Hispanic culture, oftentimes mental illnesses are not treated and they're interpreted differently because they're not seen as mental illnesses at all. Rather, they're seen as a spiritual attack or the loss of your soul. So moving on to Asian culture, something that's really important to remember when it comes to Asian patients is pain. So typically, Asian patients are very stoic. They keep a very neutral facial expression. And typically they won't report pain at all, or they won't report pain or discomfort to their doctor or nurse. And this can be a big challenge in things like hospice and palliative care. In Eastern medicine, mind, body, and spirit is very important when it comes to healing. And there's several different branches of medicine that these cultures practice, and you can see a couple of those below. When it comes to mental health, I found this to be incredibly distressing. Asian cultures are 3 times less likely to seek treatment. In fact, according to CBS News, in Japan, suicide has claimed more lives in the month of October than 10 months of COVID-19. So a lot of times mental illnesses with Asian cultures are caused by stress. Moving on to African culture, these are some of the illnesses that you're going to see that are very common in African American patients. And the important thing to remember here is that they are more likely to develop these chronic illnesses earlier in life. Also in African culture, there's a strong belief in the supernatural, and there's a couple of examples there. Looking at Middle Eastern culture, the nurse must have a pretty thorough understanding of the Islamic faith and Islamic beliefs. And we'll go more into that when we get to the spiritual part of this presentation. Also, it's important to remember that there is a big emphasis on the family system and a family unit in Middle Eastern culture. When caring for Middle Eastern patients, the nurse should provide as much privacy and modesty as possible. Often these patients want to receive care by nurses of the same gender. And as a nurse, you should also ask permission before exposing a body part. Also, dietary considerations such as not eating pork and traditions like fasting should be respected. Looking at Native American culture, these are some of the chronic illnesses that you're going to see with Native American patients and are particularly very common. It's very important to remember that often Native Americans have a deep, genuine distrust towards healthcare workers and hospital facilities. And as a nurse, you should provide reassurance, be patient, and most of all, build trust with these patients. There is a big emphasis on the family in Native American cultures. Often family members serve as the primary caregivers for Native elders. And as a nurse, you should provide the family unit with information and support. Indigenous people often use holistic practices and really emphasize life having a synergistic balance. Moving on to LGBTQ, this is a new blossoming culture in today's society, and as nurses, we need to remember to use inclusive language and be aware of those LGBTQ definitions such as they and them. As nurses, it's important to become familiar with the process of transitioning for transgender patients. Some important things to learn about include hormone replacement therapy, including side effects. Also, surgical measures for these trans patients, such as top surgery, which is the removal of the breasts, and then genital surgeries as well. And finally, mental health considerations. Many LGBTQ patients are more likely to develop a mental illness because of many years of discrimination and societal issues. These are some great resources and information for nurses about the LGBTQ community. Thank you for watching this presentation, and now on to Jessica and Jason.
My name is Jason, and I will be covering spiritual diversity. Understanding about spiritual diversity is not only important for the patient, but for all healthcare workers involved in the patient's care. First, I will cover Christianity. Christianity is an umbrella for many other religions such as Seventh-day Adventist, Roman Catholic, Lutheran, Baptist, Protestant, the Christian Science tradition, and the Amish. The Seventh-day Adventists believe that if you are responsible for your illness because you consumed something or did something that would bring harm to yourself, then that is a violation of God's law. Beliefs among the Roman Catholics include human sins causes pain and suffering, they revere death, they have specific days they fast on, and they strongly believe in using oils and prayers to assist in healing. Some Lutherans have a belief that death is caused by human sinning, and not a natural part of human life, while others believe life and death coexist and are a natural part of existence. The Baptist religion believe that when a person is terminally ill, they do not wish to have treatment to possibly extend their life. They also do not like when they are called evangelical. Protestants strongly believe in the use of faith to assist in their healing process. They also have different beliefs on why an individual goes through their sickness, as stated below. The Christian Science tradition have a belief that being sick is an illusion, and when the person is realigned with God through prayer, the disease will go away. They also believe that medicine is only a placebo and does not heal a person's illness. With the Amish, it is important to know that they only educate their young to an 8th grade level. Be sure to consult them what remedies they may have used, since they tend to use remedies instead of traditional medicine. The Amish usually only come to the hospital if there is a serious complication. If a person will have a poor quality of life after treatment, they will prefer not to have the treatment. On the contrary, they openly accept all babies no matter the defect. Among the Islamic religion, prayer is an important part of their day. During prayer, they face in the direction of Mecca. It is important for the healthcare team to know when they pray so treatment can be planned around these times. Islam's consider the right hand clean and use it for eating and drinking. When making diet recommendations, avoid any pork products because these are considered forbidden. Ramadan is important and involves fasting, prayer, and reflecting on oneself. They also believe when they are sick, they are atoning for their sins. When caring for a woman, be sure to knock so they have time to make sure that they are fully clothed. Islamic people tend to want to have the same-sex caregivers. An important aspect for Jehovah's Witness is they do not accept or give blood products. They do, however, take erythropoietin. Jehovah's do not recognize holidays, which includes their birthday. As a caregiver in a religious hospital, take in consideration about atheists and how they do not believe in any religion, only in what they can see and feel. Still inquire if they have any special practices that may alter their care. Someone of the Judaism faith have specific dietary needs. They follow a strict kosher diet, never consume meat and milk in the same meal, and they have 6 days in the year that they fast for. When caring for someone of the Judaism faith, they tend to prefer a same-sex caregiver, and they also consult their rabbi to make important decisions about their health care needs. Buddhists will receive any treatment that will prevent suffering. As they are dying, try to have someone important to them, or even you, be by their side to help them reflect about their life. Mind, body, and spirit are important concepts in Buddhism. They have a strong belief that all life is connected through energy. They have many practices which help with the healing process, such as meditation, yoga, and Reiki. Lastly, since holistic care is important in the healing process, the healthcare industry has developed spiritual assessment tools which help the caregivers know what specific needs each patient requires as they receive care. Thank you.
Hi, this is Jessica. I'm going to discuss how fostering cultural and spiritual diversity starts with us. We need to remember that practices that might be considered unethical to us could be the acceptable practice of your patient's culture or religion. Biases contribute to undertreatment and negative interactions with patients. This impacts trust and the likelihood that patients will seek health care. We need to build tolerance by practicing empathy, viewing everyone equally, and treating everyone with dignity. What do you believe? Navigating cultural and religious needs of your patients can be stressful. You might accidentally offend your patient or witness something that goes against your own personal beliefs. Certain types of people or topics may be considered too sensitive for casual conversation, but we need to think about who we may encounter in our careers. So we need to ask ourselves, are we prepared to care for our diverse population? Current events represent types of patients we may need to confront our own biases for. So, types of patients we need to consider include military, law enforcement, and politicians. Despite your political affiliation or outlook on those who serve us, these people need health care. Military personnel and law enforcement officers have notoriously traumatic careers and may suffer from PTSD and gunshot wounds. We also have an abundant homeless population in Florida. No one deserves to be homeless, and it's not our place to wonder how they wound up that way. It is our ethical duty to provide the same quality of health care and compassion to the homeless as we do to the rich. Whether or not you believe racism exists, all of these people need health care. Being culturally aware of your patient's background is extremely important. Geographical location, religion, race, and personal experiences play a role into each person's beliefs. As Kat mentioned earlier, America's racial and ethnic minorities develop certain health conditions sooner and at a drastically higher rate than others. Remembering what health problems may arise and what medications work better for minorities provides culturally competent care. We will be providing health care to the LGBTQ community. Becoming familiar with terms and asking your patient relevant questions without passing judgment is critical in caring for this population. Using terms that they prefer, such as my wife instead of my friend, is important. We need to consider the history of our country and the disparity of quality healthcare LGBTQ people have endured. We need to be cognizant of marital rights, advance directives, use of preferred gender or gender-neutral language, and practice inclusivity. I've linked a resource for healthcare personnel to familiarize themselves with LGBT considerations. This is a photo of sex offenders arrested in Volusia County. I included this because we have to care for patients who are sexual offenders, some that are even serving time for child rape. If you have children or have experienced sexual trauma, this may be a patient you did not expect to have to care for one day. Providing care for criminals of all offenses is something we need to prepare for. Desensitizing ourselves enough to differentiate between our beliefs and our duty as a nurse is important. It is not our job to decide if they deserve our care, it is our job to provide it whether they deserve it or not. We have all encountered patients struggling with addiction. We need to reiterate amongst ourselves that addiction is a disease in healthcare. When they come to us for healthcare, they are physically dependent on a substance and we need to care for them without judgment. To practice spiritually and culturally diverse nursing, we need to approach drug users with sensitivity. People suffering from addiction did not dream about becoming drug users. They are someone's son or daughter or father or mother. Abortion. Let's talk about it. Regardless of our stance, access to and the choice to have an abortion is a legal right in our country. It is also an important part of women's health history. Women of all cultures and religions utilize these services. Nurses may work at community or faith-based facilities, and these topics will surface. Whether you believe in pro-life or pro-choice, providing all of these services to women is healthcare. As nurses, we need to consider someone's lifestyle and preferences, support system, access to care, and more before we can educate someone about what contraception method might be best for them. Faith-based facilities may not offer contraception or sterilization procedures. Improving our own tolerance and practicing acceptance helps us implement best practice. Providing culturally and religiously competent care is an expectation of all nurses. Finding commonalities and embracing differences between our patients and ourselves will help us build trust. 2020 is deemed the Year of the Nurse due to the heroic efforts they have made. We will join them to represent honesty, integrity, kindness, and healing. Delivering care without prejudice is how we have earned the title of being the most trusted profession.